Well, welcome everyone to today's webinar Wednesday, which is on collaborating with partnerships, a pathway for productive engagement. This talk is provided by Dr. Lillian Agbeyegbe. And Dr. Agbeyegbe is your friendly community health educator. She is compassionate about public health education, advocacy, and a community organizer. She's worked on public health issues that disproportionately affect women and children, including HIV and AIDS, intimate partner violence, healthy housing, and human trafficking, and are impacted by social determinants of health in complex systems. She's creating a shared vision and building a sustainable collaborative partnership for improvement of health outcomes. As a member of the Maryland Public Health Association, she currently co-chairs the Communications Committee and presents their Your Public Health Professional and You program. She served as the Maryland Network Against Domestic Violence Board from 2017 to 2019, Court Watch Montgomery from 2015 to 2023, Howard County Coalition to Prevent Intimate Partner Violence since 2014, and She Rises International, Inc. since 2020. She is currently serving a third term on the Family Violence Council after being appointed by Governor Larry Hogan in 2015. She co-chaired the Healthy Teen Dating Workshop and the Abuser Intervention Program Workshop, and she currently chairs the Survivor Advocacy Council Work Group. At Polaris, a leading anti-trafficking organization, Dr. Agbeyegbe wrote The Human Trafficking at Home, the Trafficking of Domestic Workers report, and coordinated an upstream sex trafficking prevention initiative implemented in 9 cities across the United States. Dr. Agbeyegbe was the MNADV 2022 Leadership Award honoree, and in 2023, she received the citation recognition for outstanding community service from Governor Wes Moore. She also received the NBPHE President's Award for significant impact on public health in Maryland. Dr. Agbeyegbe is an adjunct faculty at Bowie State University, a historically Black university, where she teaches graduate classes in domestic violence crisis counseling. She has earned her doctorate of public health degree from the University of North Texas Health Science Center and her master's in public health and community health education from the City University of New York, Hunter College. She earned her bachelor's of science in economics from the University of Laos, Nigeria, and she is a certified education specialist and certified in public health. So with that, I'd like to turn it over to Dr. Agbeyegbe.
Hello, good afternoon, good morning, good evening, depending on where you're joining us from. I'm just going to go ahead and share my screen, and we can begin the conversation. So thank you very much, Ashley. We're talking about collaborating with partners, a pathway for productive engagement. And okay. Today, we're going to talk defining community, how to identify and engage with key stakeholders, designing and implementing a collaborative partnership, possible challenges, possible solutions, and conclusion, which will be like questions that you have for me. Now, some of it is going to be textbook, but some of it is going to be from my own experience in the field where I've worked over the years. So like Ashley was saying in my introduction, I've been all over the place doing some work on the Family Violence Council, working with partners in Louisville, even though I never lived there. In Nevada, I never lived there, but Maryland here where I live. Now, in all of my opportunities that I've worked over the years, I've worked in various organizations, and almost all of them have had the opportunity of collaborating with partners. If it was the care network, which automatically says to you that you're working with more than one person or group of organization, but even in Ideal Family Outreach, which doesn't have a network component to the name, or somewhere like Rosebrook Center and N Street Village, which doesn't really have like a network to the name, I still found out that it was very important for my work to collaborate with partners within and across sectors. So as we go on that, even at Polaris, the same thing. I have a Mentimeter. If you can just go online to menti.com and use this code. I wanted to find out, we have 3 questions that we're going to post there. I'm going to go to the Menti screen now to ask us, how do you identify? Just wanted to get a sense from people in the house, how do you identify partners? So if you go on there, Ashley, can you help me put the code in chat?
Can you just bring it back, share your screen again, and I will put it in chat for everyone.
Okay, I find myself, which is me here.
Okay, let me see. All right, everyone. So I'm going to put the link first, and then I will put the code. So bear with me as I get this for you. All right, so in the chat, that is the link. So click on that, and then it'll ask you for the 5861. Is it 211?
1188.
Okay,
Yeah,
perfect.
let me even make sure that.
Lots of ones.
I know. So I'm trying to go to Mentimeter so that we ourselves can get to see the results as it is populating. So if you go in there and put your answers, want to see, how do you identify stakeholders for a collaborative partnership? You want to identify people to work with. How do you identify network? Okay. You can do that through networking. Yes. I'll wait for some more people to say, how do you identify stakeholders? And if you're looking for the code, that's it again, 5861-1188. Listen. Okay. Influential in the group, Facebook groups, absolutely. Reputation, absolutely. Network, yes. Social events, needs. Influential in the community, I think that's what that is, yes. Social events, passion. Awesome. Community assessment, benefit, reputation, absolutely. So there's so many ways in which, you could go around identifying stakeholders in a group that you are. And let's look at the next question. It's the same Mentimeter. I just called out lead agency responsibility. What are the responsibilities? Some people were feeling a different way. Okay, I don't know whether you went to the next one, but the lead agency, usually you have a collaboration, you have a lead agency, what are your responsibilities for the lead agency? We're going to look at, I wanted us to just get some thoughts on that. And I had a last question. I don't know if anybody has done that. When you invite people to join your network and their stakeholder partners, what's their role as a partner? What do you expect from them? What can you ask of them as a stakeholder partner? You are the lead agency, you're the lead organization, and you have some stakeholder partners, and you're like, what are your, and you can go, this is like the 3rd slide, so you meet commitment, absolutely. Accountability, communication, listen, accountability, take risk-taking capacity, contribute expertise, provide insights. Yes, yes. be active, very important. You know, you don't want partners who are just here to just check the box. You want them to be active, you want them to make commitments, provide solutions, you want them to be flexible, input and share concerns, feedback, reliability, attend meetings, provide insight. All of those are excellent ideas. Awesome, great. So we're going to go back now to my presentation. And I'm going to start from defining a community. So if you're here with me, I've been doing this forever, but you know, it's still
switching screens can take time, right?
So when you want to do your work, you first have to define the community that you want to work with, you know, and defining a community can take two major things. You want to look at the composition. Your community can be a group of people which you share a sense of collective identity, common values, goals, and institution. A lot of times people define communities by geographical region, but that's not the only way in which you can define your community. You can define your community by cultural factors, social boundaries, administrative responsibilities, what your community is doing. So in my work, I've defined the community I'm working with on different factors. When I was at the Staten Island HIV Care Network, I had a community of partners. Now, all of these agencies, the top is a church, at Daytop was a community-based organization. God Love We Serve worked in the area of food, Just a Friend. The Latino Commission is the Latinos, the New York, but all of these people were on Staten Island. So my community was defined by my region. There were different partners, but they were in the Staten Island region with me. When I wanted to work on the domestic work report, though, I partnered with organizations like the Human Trafficking Legal Center and the National Domestic Worker Alliance. So my community here was defined by the focus area, which was domestic work. Now, they happened to be in the same location as I was in. So we were all located in the DMV area. But the focus here wasn't location, unlike Staten Island, where the focus was on location. The partners were defined by location. The focus was not on location, but was on a area of interest. And this was the same thing that happened when I was at the National Center for Healthy Housing, looking at alternative financing mechanism. So you see Maine, Massachusetts, New York, New Jersey, these were different places. But what was making them a community of partners? The fact that they all had financing mechanisms. So wherever it was, they were doing something with alternative financing mechanisms. So these were the partners that I worked with on this project. So you can define your partnership by location, as I did in Staten Island, or you can define your community by location, as I did in Staten Island, or you can define your community by area of interest. So how do you go about identifying who your key stakeholders are and engaging them? You know, one of the things I liked about this diagram is, you know, even though some people, as you can see from this diagram, some people are connected to some people, but not everybody is connected to each other. But you as the lead agency, everybody is going to connect back to you. So you can find some partners that are in the community and are not connected to themselves, but everybody has to, in some way, connect back to you. So some questions you have to ask yourself as you're going out and saying, who do I pull into this network? Who do I have to have at the table? Why should I have them at the table? The important place to begin is, what problem are you trying to address? What problem are you trying to address? If you're trying to address in the Staten Island network, I was trying to address how HIV impacts people in Staten Island, then that was why I was limiting my stakeholders to people that were on Staten Island, because I was looking at who could provide service for us in Staten Island. When I was looking at domestic workers, I was looking at domestic workers across, regardless of where their location was. So I could find partners who were working in different areas. The same thing when I was looking at alternative financing mechanism for home-based asthma services. The qualifying factor was home-based asthma services. It wasn't a function of location. So what problem are you trying to address? It's a very important place to start. And then you go to who's affected by this issue, who's affected by the problem. These are critical questions you ask yourself. When you ask yourself, then you go again and say, who are the key players, who are the stakeholders who are addressing this problem? Who are they related to this problem? Now, just because somebody is related to the problem doesn't mean that they're working on the problem, but it's important to find out who is related to this problem. I'll give you a good example is, for instance, faith communities. Now, a lot of people are very, very connected to their faith communities, but not all faith communities are addressing all our social problems, but they have the potential to. So you're just going to first throw your net wide and find out who's related to this problem that you want to address. Then you look at who's already working on the issue. If it's not a new problem, and chances are that it's not a new problem, there's some people already working on it. It's just that people are usually working on different places along a spectrum. So some people might be working on education and awareness on an issue. Some people might be working on advocacy on an issue. Some people might be working on funding on an issue. But you really find out who's already working on this problem, and identify those people. When you look at them, you also have the conversation about what sort of changes do you need? Is this something that is going on in the community? I don't know how many people followed the Supreme Court rulings in this last couple of weeks, where they came out and criminalized, being unhoused so that people can be arrested for being homeless. Now, we know that fundamental change we need there, it's a policy, a legislative change. But we can also work at it from saying, okay, let's make sure that we're providing enough housing for people or enough employment opportunities for people so that they don't have to be on the street. So there's so many ways in which you can address that one problem, but you have to have this conversation. What changes do you need to put in place? If you identify a problem and you have a solution, sometimes you can go on it on your own. Sometimes you can bring people together. But there's this thing we say in public health that there's no point in reinventing the wheel. It's some people have already started. It may be that they're not considering the solution that you have thought about as a potential solution. So it might just be a thing of connecting with those people and say, can we add this to the work that is already, or you're already doing? Or you might have to start something new, but you have to find out what's going on, who's working on it. Can I start something new? Should I join an existing group? Find out what resources and assets you have in your community. Again, your community not necessarily defined by geographical location, but by people working in the field. Finding out what resources, is there already a directory that exists for this community? Can you use that to leverage reaching all the people and saying, okay, fine, you already have a directory that lists all the people working in this area. Do we want to have quarterly meetings? Do we want to have an annual conference? Is there a way that we can come together and build a community of practice that we want to learn from ourselves? What do you want to do? So those are questions that are important to ask ourselves. What are the financial and political implications of the change that you're thinking about? Really have those critical conversations. And what are the potential unintended consequences of working together? I was working on a project where we came together, and when we started to look at it, the solution that bubbled up to the surface was going to put people at risk. So it's like, okay, fine, whose agenda do we follow? Do we go ahead with what we want to do? And we had to pull back actually and say, okay, this is not helpful for our partners. So while we had a plan to do this project, working in that situation, we couldn't go ahead because of the harmful effect to the other partners. So be mindful that you might find something that can say, even though you had a fully designed program that you wanted to work on, you didn't really know because you didn't have that in-depth conversation with people in the industry, and having that in-depth conversation with people in the industry now says to you, you have to look a different way. So that's something that can happen from that work. So I worked on an upstream prevention initiative at Polaris. And when I wanted to identify stakeholders in that field, I did an environmental scan, which was, I just went on Google and I searched, I was based in Washington, D.C., and I was working with partners in cities across the US. So I didn't know. So I just went, who's working in the area of housing in Louisville? Who's working in the area of domestic violence in New Orleans? Go and do a Google search and say, okay, find who's working in these areas in this place. You can also find stakeholders from doing a literature search, because some of them have collaborated with researchers, so you can identify those companies. And this shoe leather approach, I was really glad to put this in because I was thinking about the father of shoe leather epidemiologist, John Snow, who went around, to address that cholera issue in England at that time. So shoe leather approach is really just driving around your neighborhood. Driving around your neighborhood, you can find, especially the work area, or if you wanted to do something that had to do with mobile delivery, who has a mobile van, who's out there. So you go around, but is this church in this community that you want to serve, and what mobile services there? Drive around and you might be able to identify some partners in doing that. Another way to identify stakeholders is find out who are the leaders in the industry. So when I was coordinating the Staten Island HIV Care Network, you saw that I had a list of partners that we work with. So if somebody wanted to work in Staten Island, all they had to do was come to me and say, we want to do this work in Staten Island with the HIV/AIDS community. Who are the partners? I sat on the board of the Maryland Network Against Domestic Violence, and we were a resource for people who wanted to work in the area of domestic violence in the state. So you come to the network knows who the service providers are and where they are. You find out some existing group in the area and work with them. On that project I was working with in Polaris, Polaris also has housed the National Human Trafficking Hotline. So we already had partners who were working in that city. So I went to my counterpart in the sister agency and saying, who are the existing groups that you're working with? So you do an environmental scan, you find the leaders on the field, usually through coalitions, through networks. But another way to do it is a snowball method. You talk to somebody and you say, oh, by the way, do you know who else works in this field that I should be talking to? This is what I'm thinking about. And using that method, I got a whole bunch of people to work with me on that project. As you are navigating all of this, identifying the people, you want to make sure that you're getting some key categories of people. One category of people, very important to get out, people that are called gatekeepers. The padlock and the gatekeeper, because the gatekeeper can determine whether you can gain access to the community and the population that you want. They can shut the door against you and keep you out, or they can let you in. It's not a formal gate, but because of interactions that they have the potential to really keep you out. So you want to find out, who are these gatekeepers? They are similar to opinion leaders, but not necessarily so, in the sense that the opinion leader is not really trying to keep you out, as it were. But if they share their views on, we don't think this project is helpful for our community, without saying anything, people just gravitate to what they say. And so if they are saying that your project is not helpful for this community, then you are not going to go far. They can be called survivors, they can be called victims, and these images different names. They can be called thrivers, inspirers. I've heard them be called thrivers. Whatever it is, however they're called, they just have to be people with lived experience, and it's important to bring them to the table and have them as members of the group. Now, how do you find these people and bring them in? In some cases, it's very simple and straightforward. In the CARE network, this was a group that was founded by Rand White Funding. So the funding defined for us who needed to be at the table. It defined for us who needed. So we did something very simple. We just put out leaflets and say, call us if you're interested. Come and join our work if we're interested. The funding said to us, we needed to have providers, we needed to have consumers, we needed to have working groups. So it was like, okay, fine, call us and come and be a part of us. When I worked on the Upstream Prevention Initiative in Polaris, however, it was a very different case. We identified the problem looking at the National Human Trafficking Hotline data, which said to us that trafficking didn't happen in a vacuum. Traffickers were targeting vulnerable people in their communities, and that was all we had. Data said that trafficking was happening across the country, so we wanted to go to work in different cities. But what we didn't know was what solution was applicable to what city. We didn't know what solution was applicable to what city. We didn't know which partner we should identify or work with in each city. So there was an engagement protocol that I used in dealing with people on the Upstream Prevention Initiative. First, remember I had done the environmental scan. I talked to my colleague on the National Human Trafficking Hotline. I'd gotten contact information. I'd had people refer, mention who else I should talk to. So I had this process where I first sent an introductory email, and I said, look, this is my name. I work in this organization. I'm thinking about doing something, and I want to talk to you for 15 minutes, just an introductory call. So then we had our first meeting. At that first meeting, I went into a little bit more detail about the project. Like, this is an upstream prevention. We're going to have a needs assessment. I'm going to need you to participate in one personal interview, in one focus group session, in one prioritization session. So I'm going to need your involvement for about this many hours in the month, and and this is what I will do. So if people agreed on that first meeting, then I scheduled them for a one-on-one key informant interview. After the key informant interview, then I brought people back together for a group meeting and focus group discussion. Now, as you see that by the time people come to this focus group discussion, I'd already interacted with them 3 times. One by email, you can say, oh, but that's an interaction, because then at least they already knew my name by the email. By the first 2 meetings we had, they already knew my face. So when we came to these group meeting sessions, even though I wasn't in their cities, I wasn't like a stranger to them. It was somebody that they were familiar with. And so we had a focus group sessions where we looked at the needs. We had a focus group guide and went into details of what we were doing, went back, strategized, and said, okay, what came out from those discussions? Then we had a prioritization session where we ranked the things that came out of the focus group session, went and did the work, and came back to provide feedback to the community. So all of these were steps that I used in this interaction for this upstream prevention initiative. So in terms of designing, and I've already talked a little bit about that, designing and implementing the collaboration platform, you always need a lead agency. In this case, I was the lead agency. One thing I like about this image is, even though the person in front is like the leader, as you see, there is a connection to the other people. You are the leader, but you still have to have that connection to run what is happening. So you provide, the lead agency at least provides the overall vision and strategy. I brought people to the table. So this upstream prevention initiative was, I had, based on my work from the National Human Trafficking Hotline data, I had said, there is a problem with trafficking, sex trafficking in your cities, and it's affecting vulnerable populations. That was the overall vision. You know, the strategy was that we had to let each city define for us. So I wasn't going into any city with any preconceived notion from another city. I was saying, this is what we want to work with, upstream prevention initiative on trafficking, and we're going to let each city define for themselves what we're going to do in the city. Now, you have to be able to support allied activities, the things that came out related to my program, but also from other agencies, because I didn't want to do the same. I just want to come and take from you, and I don't care about what's happening to you. So there were some other things that came up that were not directly related to my program, but I had to be open to support allied activities, establish shared measurement and practice. So if you remember when I said, I told them at that second meeting that, we're going to have these many sessions. I had already, defined that this how many sessions. What we were going to discuss at those sessions, I had not decided. What was going to come out from those sessions, I could not predetermine. But I needed to be able to tell people what their time commitment was going to be, what their resource commitment was going to be upfront. So you establish that before you go out to people. You build a public will. You're the one responsible for talking to the conversation and monitor what's going on. Whatever comes from that, it's your responsibility to advance those policies and to mobilize funding for the work. People have already developed their strategic plan. They didn't have your project in it. So you are coming in now at the middle of the year, or even if it's the start of the year, the point is they didn't have your project on their strategic plan, and you have come in with something else. So you have to be ready to mobilize funding for the work. Now, the experts that I put on the table, like I told you, I said lived experts, they were priority population for the upstream prevention initiative, because the trafficking sector, if you've worked in that sector, you know that Survivor says nothing for us without us. So they were primary important population for me to get at the table. When I worked on the alternative financing mechanism at the National Center for Healthy Housing, I didn't have lived experts. I didn't have people suffering from asthma or lead poisoning at the table, because what I was looking at was, how do you fund services for those people? So already people are suffering from this, and we know that providers are the ones that need to do. So they were not, lived experts were not a priority population for that group. But in my upstream prevention, they were the primary people, they were the people I started with. And then I looked at industry partners, people who are already working in the trafficking sector, just again, because we said you don't want to reinvent the wheel. So I wanted some people at the table. But that was an upstream prevention initiative. It wasn't responding to trafficking. It was addressing trafficking before it occurred. So I looked for people in tangential industries. I'm talking like industry like domestic violence, and brought them to the table. I also looked for people in allied industry. Sometimes you find out that people get into trafficking situation because they're looking for work, and somebody advertises a false job offer, and they go and they think that they have a job offer, but they're going to wake up and find out that they're in trafficking situation. So I look for people working in the employment sector, in the housing sector as well, and brought all of those people together. Now, when you bring people together, you have to be able to delineate what are there, and this came out when we looked at roles and responsibilities in the word cloud earlier on. So there's some people you want to inform what's going on, you want to consult them, you want to collaborate with them. You as the secretariat, you are the one who's going to be keeping scores and record, reminding people about the meetings, drawing up the agenda, circulating materials. If this policy came out, you need people to read about it, and make sure that everything is going out to everybody. Do you want to create a newsletter? You're just going to have a group email chain where you email everybody. Sometimes you might need a memorandum of understanding. In all of my roles, I only used the memorandum of understanding in one position, and that was at Ideal Family Outreach. And that was because we gave money to this stakeholder partner who was implementing a project for us. So in the case where you're not giving money, you might not necessarily need a memorandum of understanding. You're just depending on people's goodwill. So of course, you're expecting them to attend meetings, you're expecting them to do whatever it is that they said they're going to do. But unless you're actually giving them funding, you might not need, and I'm probably answering a question that I saw earlier, but anyway. So you will find that in your stakeholders, you have people, I took this from the project management guy, sometimes it's good to keep this in your stakeholder heart when you're working with partners, who are the people who have power and interest in what you're working on, and determine your engagement based on where they fit in the metrics. So are the people that you want to keep satisfied, people you want to keep informed, manage closely, and you want to monitor? It depends on the projects that you're working on. We have some recommendations from the National Association for County and City Health Officials, where they tell you this. And I just wanted to put this because this is a technical thing, not necessarily because it was, I used all of these spaces in my upstream prevention initiative, but this is a tool that you can go to at NACO and look at how do you mobilize for partnership. Want to be thinking it's an your decision is never really, you don't make a decision and close the door on it. You keep going back and fine-tuning things and making things work, but you want to collect data, you want to prioritize, and you want to intervene. One of the key things I wanted to share about this, my upstream prevention initiative, was how did I get people together in a different city during the pandemic or post-pandemic. So Google Jamboard was something that I used. And what I liked about the Google Jamboard was a brainstorming tool that we used. I had different boards for different ideas. So when we talked about what does vulnerability look like in your city? Who's vulnerable? What makes vulnerability exist in your city? What do you think are potential solutions to addressing these factors in your city? And who are the stakeholders that should be involved in this project in your city? So those were 4 key things that we wanted to address in each city. And so I had a different board for each focus area. The good thing about a Jamboard, and I wanted to show you a Jamboard, but Google has closed down the Jamboard right now, so it's no longer a tool. But one of the things I liked about the Jamboard was it allowed people to share freely. So people who know the Jamboard, it's kind of like a whiteboard. And then you had the option to take a Post-it and put on the Jamboard. But it didn't show you the name of who was sharing what. So that anonymity was very helpful for engagement because anybody could put in anything. The other thing I liked about it also was that it was concurrent sharing. So we didn't have to take turns. But what we did was we just took time, we discussed an idea, and we just said, okay, for the next 10 minutes, everybody write what they think about this on the Jamboard. So it allowed for concurrent sharing, whereas if people were talking, you will have to wait for this person to finish and then the other person will talk. But we didn't have to do that with the Jamboard. We did pre and posting discussion. And what was this was clarified. So when we said we're talking about vulnerability now, who's vulnerable in your community? Like, what does that mean? We mean people who don't have access to safety net facilities that can keep them from exploitation. So because if you just put who's vulnerable, you don't know whether people understand that. So you allow people to question and say, is this what you mean? You explain that. And then after people have posted it, we had a post-posting discussion and say, okay, fine, what's surprising to people in this? If there's something that wasn't quite clear, it's like, can we get some clarity on this idea? What's new, what's surprising, what do you agree with? And then we pull things together. So we had the pre and posting discussion. It was a time posting though, so that we could keep things moving because we had asked people for a commitment of 60 minutes for this session. So like, okay, fine, 10 minutes you post, 10 minutes you post, 10 minutes you post. So that helped us to gain different perspective in this. Like I said, Jamboard has already closed, but I Googled alternative to Jamboard, and I found out that there's so many options that out there, and so you can consider them for the advantage that people can be posting simultaneously. It allows for anonymity, so you can get a lot of feedback if you decide to use any of these tools in your conversation. So I said we went to different cities and different things came up. And it was, if you go to the Polaris website, you find out that different things came up. The one thing we had was that sex trafficking was happening and it was affecting vulnerable population. The results that came out was different for different places. In San Diego, it turned out that we needed to address a safer space for people in LGBTQIA population. In Louisville, it turned out that, homeless youths were being put in a situation where trafficking was a possibility for them. In Philadelphia, it wasn't so much of homeless youth, but youth having a aftercare program or a drop-in center. They had adults drop-in center, but they didn't have one for youth. So it's like, what do we do for a youth drop-in center? Our folks in Dallas wanted a survivor advisory council, and that was what we put together in Dallas. And in Boston, we put together a conference for intersection of substance use and human trafficking, which was interesting because when we started to have these conversations, people were talking about people in the trafficking sector who had providing services for trafficking victims and survivors and say you needed to be substance use clean before they would take you in the program. But if somebody is with their trafficker who needs them to be on substance use, how are they going to get clean for you to take them in the first place? So it's almost like you're telling them they have to stay with their trafficker. Substance use practitioners, on the other hand, who are like treating somebody who's in a trafficking situation as an outpatient. So you're giving all this person all this medication and you're releasing them to the person who needs them to be on substance. You think they're not complying, you think they're not making progress, but it's really because of the conditions in which they are. So we brought all of these partners together, and people in Boston were like, we have never had this conversation before. So here was an organization outside of Boston, but all the partners were in Boston, but really bringing that national lens of what's going on in the field and saying, how do we have that conversation? And that was what we had in Boston. Was this a walk in the park? Absolutely not. So we had some challenges, and key one of it is you don't think about it, but natural disaster. So we were working in New Orleans when Hurricane Ida hit, and of course I had my own timeline for my program, and I called my partners and they were like, Lillian, we don't even want to know you exist for the next couple of months, for a valid reason. They had people who had become unhoused. They had people who were looking for things to eat. So you want to come and say we're talking about trafficking. It didn't work out, so it was like, you need to take a break. And so I had to take a break and step away from that city and continue to work in other cities, but I had to step away at that time. We also had COVID, as some of you may remember. So that was also something that impacted us going into the cities and doing work because we couldn't travel. Another thing that came out, assumptions are made and most assumptions are wrong. So one assumption I found out that some partners had was this was a national nonprofit that was coming into their city and they thought we were bringing funding for their work. And we had funding to arrange meetings and do this, but we didn't have funding to start off projects or to give organizations to go on with. So, but I didn't have that conversation up front because I really didn't know, I guess, the way people thought about the organization. So I didn't really know that people were going to think that I came in with funding for their project. And then there were about some stakeholders who are not working on the issue. I remember calling some organization and saying, I wanted you to come. And they're like, we're not a trafficking organization. And I was like, I know, I'm calling you. That's precisely why I'm calling you to come to this project. But the assumption was that they needed to be trafficking to work on this project. But because it was an upstream prevention initiative, I was looking at ways of preventing trafficking before it happens. So I needed other partners to be at the table, but it wasn't something that was obvious to a lot of people. So I had to do a lot of explaining along that. And then I had a concept of project creep. There were people who were like, yes, this is a problem, but I had to say to people, I'm not saying that this is not a problem, but I'm saying that we want to address, so if I say San Diego, for instance, we wanted to address a safer space, but it turned out that housing was a need for the LGBTQIA+ population as well. And so even though we said our population of interest was the LGBTQIA+ community, actually the focus was on a safer space and not necessarily all the needs. So there was that challenge of trying to say, are you interested in LGBTQIA+ population or not? And saying, yes, we are interested in population, but this is what we want to focus on, So that was something that we had to deal with. We also had to deal with the issue of existing priorities. So I worked in some organizations who said, yeah, this is interesting, but actually we're having some issues right now, and the new director, and I've come to salvage this organization. As important as sex trafficking prevention is, we need to stabilize this organization right now, and we cannot afford to take on anything external. So there was that organization restructuring. Then there was sector priority. And not in this case, but in another situation where I worked in, was trying to work with the restaurant industry. And at that time, the restaurant industry was trying to work on address the issue of tipped wage and daycare for our workers. So this is not a priority focus for us. And you have to go with what the industry priority focus is. There's such a thing as also, I found out about aligning timelines. So I like this image when I found it, because they are, if you see the red and the red, it's the same thing, but they are aligned differently from the top and the bottom. And even though this was a timeline, when I wanted to use it was when we went into Minnesota, we wanted to have a conference on the intersection of substance use and sex trafficking. And the people were like, this is a brilliant idea. Our conference was, we wanted to hold a conference in the fall of 2022. And they're like, but fall of 2022 will not work. We had worked with some partners who thought fall of 2022 will work, but eventually some other partners said fall of 2022 will not work. And so we had to push back on that. And so you have to work with stakeholders' timing. Funding was also something that became a contentious issue because of territorial issues. So we're getting funding from an organization, and that was also funding some local agencies. So it became like, are you taking money from local agencies to fund your work? I really had to clarify to say that we actually get funding from a different stream, even though this organization funds local. So it's not that we are taking money from local funders. Explaining that where we get the funding from was very important, one of the problems that came. How did I address those problems? Well, I had to be flexible, like I said, so the timeline, we moved the conference from fall of 2022 to summer of 2023. We really had those conversations with San Diego and said, look, we can't do that. From establishing to supporting. This was what happened in Philadelphia. We started with talking about establishing a drop-in center for young people, but we found out that a drop-in center existed, but was not really fully functional. So instead of establishing one, we said, okay, this drop-in center that already exists, what can we do to make it more functional? And that was what we ended up doing. So we had to be flexible about that work. Internal information sharing. Now, we didn't really want to share, well, we normally wouldn't share how we got that funding or our different funding streams, but really just saying that it wasn't something that was confidential, but just explaining to this partner who was thinking that, are you coming here to take money from us? To say, no, actually, we've gotten funding for these people before, and we're not taking money from you. So explaining that to clarify, that helped. We went into cities and people thought we brought funding for them, but we didn't really have funding. So what we did was create a fundraising fact sheet. to say, okay, we can't give you money, but we can share with you some of our tips on how to raise money. So you can use that as a guide to raise money for yourself. We also were able to help some partners, we'd say, okay, we can look over your grant application. We can't give you money, but if you wanted us to share that, we'll do that. And be transparent about the work that you're doing. So if it's non-confidential information, it's not in the public, but non-confidential. See how you can share that to make sure that you are really being open to the people that you're working with. And that is it, people. I will stop and I will take questions now.
All right, well, thank you so much. If you have any questions, you can put them in the Q&A or chat section. I will see them both. So please feel free to type those in there, and we will have Dr. Agbeyegbe read through those. Okay, so starting off, the first question I have is, should we participate in collaboration without an MOU? And I think you talked a little bit about this, but
Yes. I think, I talked a little bit about it, in that you need an MOU most of the time if funding is involved. So if you're just asking somebody to attend meetings and to provide, information and support, and you want them to sign an MOU, kind of feel like, hey, you're asking for too much, but most organizations are not going to use your name on the materials. The MOU does things like specify, we're working together, but my agency is my agency, your agency is your agency. So you can't use my name on all your materials just because we're working on this, And even this one, if you want to use my name, we should get some clarity. So you don't really need an MOU unless you have money involved and you have specific outcomes that you want to demand from people. Otherwise, you can just join the coalition, go to the meetings, take your assignments, and be committed to them.
great. Next question is, how much flexibility should we accommodate in collaboration?
As much flexibility as you can accommodate, So I talked about Minneapolis, where I had a conference that was already planned for fall of 2022. And we ended up shifting that to summer of 2023. That was a timing thing I could do. However, in San Diego, the focus, there was some conversation about shifting our focus area from a safe space to housing. And whereas that was a need and we wanted to be flexible, we also wanted to be true to the partners who created the needs assessment. So we had a whole collective of people come together, and what had come up was a safe space. And so having, one or two partners coming on later on and say, this housing is a crisis, that was going to be too much flexibility to shift that, coupled with the fact that we were going to now leave the safe space unaddressed if we went to do this, So you can't totally deviate, but accommodate as best as possible.
All right. Our next question is, what if we are a part of a committee on a university campus, but it seems to be not achieving anything? Any advice?
Yes. So in that case, you have to talk to the partners. I mean, and that's communication is very big today. Sometimes people put things on. Why would a committee not be achieving anything if it had goals and if it has timelines? So you have to go back to the drawing board and say, okay, what are our goals? If you have goals, then you should have timelines. And if you don't have goals, if we're just together, but find out what is the problem. So I sit on the Family Balance Council, like we said, for instance, and one of the things that we found out was that we were reevaluating people, abusers intervention programs without a clear-cut scoring rubric. And we said, okay, by the time the next applications come out, we wanted to be able to grade them on a scoring rubric. A scoring rubric is not going to be developed overnight. We had to have meetings. We had to scout for templates that we wanted to follow. We had to look at our own application. We had to say, What do people have to do to be approved? What do people have to do to get an A? What do people have to do to get a B? What do people have to do to get a C? When somebody gets a B, can we give them conditional approval? When somebody gets a C, is that an outright deal? So there were things for us to do. And there was a timeline in which we needed to achieve it before the next cycle. And because of that, there was no meeting. We had to meet consistently to get it done. So if nothing is getting done, then that means there's no clear-cut goal and there's no clear-cut guidelines. So you need to go back to the table and say, what exactly do we want to do and by when? And that will really make sure that you put goals and a timeline in place.
Okay. All right, our next question is about funding. Should we accept funding from a stakeholder partner?
That's interesting because, everybody wants funding, right? Funding is always a good thing. Here's the thing though. If you accept funding from a stakeholder partner, it's almost like accepting a grant. So you know that they will have clear-cut expectations from you. The chances that stakeholder is going to give you money with no strings attached is very slim. What is advisable to accept is space donation. So somebody says, can we have this meeting in your space? You can take their space. We can provide lunch. They can order the lunch and deliver it at the meeting. You're having some survivor leaders and they say we can provide gift cards for the people. But you as an organization, when you want to accept funding, just know that you're stepping into that sort of grantor and grantee position where there might be stipulations that you will be required to comply with. If you are not ready to do compliance with requirements, that might be a no.
And then I believe this is our last question. What are some partnership deal breakers?
Some partnership deal breakers, I think, San Diego, for instance, is project creep. If they had insisted that we go and do housing, that would have been like, okay, fine, this is not what we signed up. And it may also be because of our capacity, right? So this is not what we signed up for. So you can ask me to move a conference from one period to another time, but to say that change or somebody begins to insist on who should be at the table, that's I don't, and the funny thing is some circles already have some, there might be some bad blood and, they're like, don't work with these people. You actually can't do that because I don't know what problems you had with them, So some stakeholder is when people try to exclude or try to do project creep, it's like, we really don't have the time for that. We really don't have the funding for that. And we really are not involved in that, whatever is going on. So you must know what you set out to do, what your guidelines are, what your expectations are, and anything that is going to drastically take you away from that. You don't want to, be hearing somebody saying we're coming to that meeting and nothing is happening, So you want to make sure that you have clear guidelines and that you can follow a timeline for your clear guidelines. Otherwise, you'll be wasting people's time.
All right. Well, so thank you so much for the presentation today. It was very educational. And thank you everyone for attending. We hope that you will be at our next webinar when we have it. So again, thank you, Dr. Agbeyegbe, and everyone have a great rest of your day. Thank you.
Thank you. Bye.
Bye.